All right. I am with Valentia. Can you please remind me your new surname?
No, call me by Serepa.
Serepa.
Yeah, my new I haven't signed this yet. My new surname though it's Mafani.
Oh, okay. Oh, you just have to go and certify it with the Home Affairs guys.
Yes, I have. Yes, I have to go there and certify it.
Yeah.
Yeah. Put it
Talking.
on paper.
Yeah, you have to put it on paper and do all the contractuals and all the other stuff.
Yeah.
But anyways, we're not here talking about her marital status, but I'm talking to my high school mate from all the way in St. Brennan's and
Limpopo.
Limpopo, yes. I mean, those were good times. If we're to look back,
Yeah.
I feel like I had a good time when I was in high school, and we had a trial podcast, but just that we had some few challenges.
Yeah, we did.
But we
I'm
have
glad
to,
we're back.
yeah, so we have to kind of like redo it again, and yeah, we're just gonna quickly just dive head first into the stuff. So I just want you to just introduce yourself. Who is Valentia Serepa?
Valentia Serepa. Mafani.
Come on.
It's just a simple girl. Was very lively back then. Was called Virus. Life of a party. But then yeah, that comes with growing up anyways. So yeah, I am now a registered counselor. I'm a wife, I'm a mother, and I'm also a YouTuber. And yeah, that's all about me. It's just a simple girl who loves living life, beautiful things, good people.
Awesome. There you go, guys. That's Valentia Serepa, a registered counselor. And maybe you can just talk about your YouTube, or what inspired you to have a YouTube channel.
My YouTube, ne? I've always wanted to open a YouTube channel, but then I had a problem with self-esteem, confidence, because I had always have that in mind, at the back of my mind. I was like, what will people say? Will I even survive the pressure, negative reviews and all that? But there are people who actually encouraged me, told me that, you know what, you don't do it, you do it. People always have something to say. So you just have to do it and see how you can just dive into it, how you can go, how you can just dive into whatever that you have to do. Just do it. So I did. I tried actually, and I did. And I think it's going well. And my YouTube channel, it's mainly about your psychological aspect of life, your mental health, most probably, and also to show people that you can still live life. I do vlog sometimes.
Sure.
Yeah. So yeah, that's more
great.
like it.
Yeah, I think what I like about your YouTube channel is you at least talk about the topics which are like the hot topics that are happening now, like depression.
Yeah.
I mean, it's something which it's a word that's being thrown around a lot. I don't know what's happening with my son. Yeah, it's a word that is being thrown around a lot, and it's a word that's being thrown around a lot, and it's.
True.
I think most people don't really understand where is it coming from, but it's good to have someone or some people who are actually talking about it. And you know, this it's so tricky because you see now with mental health or depression, you know, even the last time we were talking, I was just having a hard time trying to differentiate between mental health
And depression.
Maybe can you please just kind of like break it down for me from the top? Where is mental health, where is depression, where is trauma, where is all these things? Maybe you can just break it down for me.
All right, no problem. I will most definitely do that. But you were more the last time, and now you were actually more interested in knowing about depression.
Sure.
So I'm gonna start with depression. But bear in mind that mental health has got mental illnesses, be it your depression. So it's mental health, underneath there is depression. Those are mental illnesses and disorders.
Okay.
So I will explain mental health later on because, you wanted to know more about depression. So I'm going to dive deep into what is really a depression.
Okay.
I've also realized that most people don't actually understand what depression is, and it can be very difficult to actually explain what depression is because it's an invincible disorder. And stereotype tells us that people with depression are weak, which is not true. So with that being said, I can say that depression is associated or is defined as it includes thoughts, it includes feelings, it includes your behavior as well. So for you to really understand what depression is, personally, I think you should understand the symptoms of depression. You understanding the symptoms of depression, I would always break it down so that you can really understand where it comes from. Breaking it down, I break it down this way. I don't know if you understand me.
I'm following.
You follow. Okay, great.
Yeah.
I want you to conversate so that
sure.
we move in the same direction.
Yeah.
So I always break down symptoms of depression in this way. I would always say symptoms related or associated with feelings. Associated with feelings meaning sadness. Sometimes you feel angry. Sometimes you are anxious, or you just wake up feeling sad that day, or you just lose interest. I'm gonna give you an example. Maybe we might be at a restaurant, to put it, your normal things, like you go out and whatever, and then all of a sudden it just becomes sad and you just don't understand, and then what's wrong with Shepherd now? It's something like that.
Yeah.
You don't control it, it just happens.
So with
That's
depression,
feelings. Yeah.
Yes, with depression, you said it's feelings, right?
Yeah, those are feelings.
The way it sounds, it seems as if it's something which, does this happen over some time, or is something which can just be a certain realization, like a I don't know, a panic attack. I don't know how a panic attack works, but it sounds like something that just happens abruptly. And so does it build up over time, or is something which just manifests, you just feel sad out of nowhere?
It just happens out of the blue. But with attacks, because you don't understand what's that, I'm going to give you an example with a friend of mine who actually have depression. So when we walk on the streets, walking, and then she was once robbed, to put it like that. When she says people who she's not comfortable around with, or maybe she thinks that they are going to rob her or something. Like those people, the construction workers kind of people.
Sure.
Yeah. She would have panic attacks. Like it's like heart palpitations. So she will start having like a fear of going through that street. So we'll change streets to go to another direction to actually walk it, because like she's not going to be fine. So meaning that I have to be calm and I have to help her. I have to tell her that I'm here. Nothing's going to happen to you. Like it's like reassurance. Yeah,
so which means
something like
it's with depression, it's something which can either be something that happens abruptly, or something that has happened over the time.
Yeah.
So is it? So I want to find out, because you see, you mentioned depression as feelings, and mostly seems like it's the negative side of feelings, right? Which is sadness and feeling,
sadness, guilt, hopelessness. Yeah.
Those feelings, right? Is it something which are a build up from somewhere, or is some like I was saying?
Yeah, I was actually gonna come to that as well.
Sure. So probably you can also explain.
I was gonna come to that. That's why I was breaking it down, like breaking down the symptoms, and then I will get to that, because sometimes it starts somewhere. Yes. So I'll go to that. Let me just finish the breaking down of the symptoms of
Sure.
depression, because I started with the feelings, right? So now there are symptoms as well related to behavior, as I've explained. So those ones that are related to behavior, it's social behavior. You become antisocial, you become isolated sometimes. You have lack of energy, you lack motivation in most of the things that you would always wanted to do. So you feel demotivated, you feel demoralized in all aspects, most aspects. And there are feelings of thoughts now. Feelings of thoughts, sometimes it's related, not sometimes, mainly related to thoughts of suicide, self-esteem, low self-esteem. And sometimes it's also related to, it's like loss of interest in regular activities. You no longer feel interested in, maybe you are used to, you're a morning person where you'd wake up and go and jog every morning and all that. That's you. All of a sudden you just lose interest.
Yeah.
Those are regular activities.
Yeah.
So it's something like that. So with that being said, when you said that it starts somewhere, sometimes it's related to environmental factors. Environmental factors, be it poverty, your upbringing, your background. It also affects that. And also your how do I call it? Your like if you experience a traumatic event and that affects you, because like we don't really know what really triggers depression, but if you have experienced that or you have a childhood trauma, it actually triggers whatever that you had. Or if you had experienced some episode once in your life or experienced something similar to what I've explained, like those symptoms, there are likely possibilities that you might have future episodes when it comes to that. And I also mentioned that family genetics or family history. If somebody had or have depression in your family, you are most likely to actually have depression. So yeah,
That's quite interesting.
it is.
Because you see, in life, I don't know in terms of there is levels to trauma, right?
I would like to believe so.
Right.
We understand it in a different way, but then I would like to believe so.
Yeah, because at a point you'll be traumatized somehow, whether it be you're in your family, friends, or school. So since trauma is inevitable, right?
No, it's depression. It's invincible.
Yes, that's why I'm going, right?
Okay.
So since trauma is inevitable in a lifetime,
all right,
you will have like several episodes which you can say that, okay, that's why I was asking that there's like levels to also trauma, because someone can just be traumatized by falling. But it's not really traumatizing, but someone can be traumatizing, right? So
I like that because trauma or whatever that you might experience in life, they treat us in different ways. We receive in different ways. I might explain my trauma to you and then you feel like, whatever. You feel like, no, that's not trauma. And that will help me. It will hurt me so bad that it might take me back. Maybe I was healing from whatever that I was going through, and then you're taking me back. Yeah, so it's something like that.
Being rejected.
Exactly.
Yeah. No worries. Yeah, so as I was saying, that with trauma, there's like levels to it, right? And
I'd like to believe.
Since there is levels to it, what that means, no one is spared on a feeling of being depressed. Would you say that everyone, in a sense, they could be depressed because all of us have went through some form of trauma?
No, not everyone will have depression, to put it. Yeah, so mostly depression, it's been diagnosed, like I explained previously, and then psychiatrists actually do diagnose that, and then you just have to treat effective treatment, be it treatment. There's treatment for depression, and there is psychotherapy as well. That's effective treatment. It can actually help you to eliminate those symptoms, but that doesn't mean that the depression goes away. You just are able to manage or diverge through it in life so that you can be able to live normally. Okay. Yeah, that's why I would always say don't put depression as your identity, because once you put it as your identity, you actually become more depressed every day. You wake up and say, I'm depressed. I have depression. Nobody sees me. You're gonna be that.
So I like that because it's so I don't wanna use the word weird, but it's so funny how the moment you say I am depressed, right? You say that just by putting yourself in the label of being depressed. It makes it stronger in a sense.
Yes.
Right? So would you say, talking about mental health, right?
I'm moving. And I want right? It's fine.
Yeah, it's fine. Let's have a conversation, right?
It's fine.
So talking about mental health.
All right.
Wouldn't you say that that's also being delusional? When you say that I'm not depressed or not boxing yourself, not labeling yourself as someone who's depressed, though you were diagnosed.
No,
so isn't there a contrast between these two mental spheres?
No, you know that you are depressed.
Okay.
Ne? You know that you have a chronic illness, right? And you are doing something about it, right? There's one friend of mine who doesn't really like talking about her depression. And it doesn't mean that she doesn't really want to talk about it. It's like she doesn't want everybody to know that she's depressed. Do you know why? Because people start feeling sorry for her. They start treating her somehow. So she wants people to treat her as normal because she's a normal human being. She just has a chronic illness or a chronic disorder. That's just it. So I would actually urge people to, maybe if I have depression, I would educate people who are close to me or loved ones to know more about depression. Just in case, if I have episode, they know how to react or they know what to do.
Oh, so basically, it's important when you have depression to kind of like break it down for whoever who's going to be like
somebody who's close or people around you. Yes,
so they kind of like know how to
exactly.
Yeah.
Act. And there's also psychologists. Most psychologists actually do give let me just say we do give our patients pamphlets for friends, those who want to know more about my chronic disorder or illness, be it depression or whatever that it may be, so that you just know what exactly it is and how to react when certain things happens or certain situations, something like that. So it's best to do it that way, because most families don't even know what depression is, and they'll be like, "Oh, we're not only depressed," as if it's something. I don't know. I don't understand how people understand it. That's why I said that it's very much difficult for people to understand what depression is. And with that being said, a lot of people or friends would say, maybe if I just wake up feeling sad or I just wake up feeling demotivated, a lack of energy, they'll feel like I'm lazy. They'll feel like, nah, this one has moods. This one, it's sure. Like they'll start labeling me as somehow. It's not like I woke up and decided that I want to act like this or I want to be like this. No, guys, it's not like that. What's in our head isn't imaginary. Right. So our thoughts, behavior are influenced by a complex series of chemicals in our brains.
Okay.
Yeah.
Talking about all these complexities, there's another thing which I actually like. I think I once heard that social media is one of the biggest contributors to
cyberbullying.
whether it
To
be
put it.
cyberbullying or you judging yourself with others, or comparing yourself with others. Um, what is the contribution
To social media, from social
of
media.
social media on depression? What are your thoughts on that?
My thoughts is I'm gonna label, or I'm gonna put it as cyberbullying. Do you know that people bully other people on social media? They would actually, you actually lose yourself on social media. You actually have low self-esteem. Um, the pressure that's around social media, more especially with us girls who feel like, no, but then I want to dress like who and who, I want to be beautiful like who and who. Do you know what did they do to get whatever that they have now? Or are they working as hard as possible to get whatever that they want? Why don't you just try, stay in your lane, and yeah, do you? That won't affect you. We get affected. It's peer pressure sometimes. It's cyberbullying. People are being bullied on social media.
Yeah.
People are being bullied by their disabilities on social media. You don't get to bully someone about their disabilities or about how they look. What do you think it will do to me?
Yeah, it messes up with your self-confidence.
Yeah, it will. It will. It will affect me. That's low self-esteem. It comes, that goes to symptoms of thoughts.
Okay.
When I have low self-esteem, I'll have, what do you
I'm
call
not good enough syndrome.
Exactly. I'm not
Yeah.
good enough syndrome.
Yeah.
That goes to where? Thoughts of suicide.
Oh, okay. I see.
It's something like that. So those are all symptoms. Do you understand why I broke it down to, like, if you understand the symptoms of depression, you would actually understand what's depression. Do you see what affects it? You mentioned a
Okay.
good point about social media. It goes back to feelings of thoughts. Symptoms of thoughts.
Symptoms of thoughts.
Yeah.
Okay. So, which means that those symptoms that you were explaining, like feeling sad, anxiety, those are the birthplace of depression. If I
You can put it that way.
Right?
Yeah.
So you also mentioned things like what do you call this? What's this now? You also mentioned trauma.
All right.
Also brings you into depression, right?
Yeah,
So
I will
so
explain
maybe,
what
so, yeah,
trauma is so that you can be able
yeah,
to
that's what I want
understand.
to actually ask
Yeah,
to talk
it's
about
fine.
it, so that at least we can just understand. So since now you've explained the symptoms, maybe we can just move on to trauma. How is it linked with
Everything.
with
Mental health, depression, whatever. Yeah.
Also, is it literally linked with everything as well?
Yes. So, okay, fine. Let me explain trauma so that you can be able to understand it. But before, because you like being diagnosed when before that, are you fine with depression? Are you
Yeah,
fine with
yeah.
the explanation? Are you fine
Yeah,
with
I
the
think to make it easier, let's make it a dance. We can just jump in and out within.
we will,
Yeah,
but
so,
then I just want to understand if you get it.
yeah. I still have more questions, but I just want
Alright.
to. I just want to see how trauma is like
Okay.
linked to depression. How does it?
All right, no problem then. I understand. So what I can say about trauma, yeah, is over 70% of people worldwide have had one experience of trauma once in their lifetime. Over.
Yeah, it must be over 80%.
Over. Yeah, it's that's why I'm saying over 70%. So I just don't wanna,
Yeah,
So
sure.
yeah, so trauma it's a threatening event or series of event, and they also include they affect you emotionally or physically. Be it can be anxiety, it can be violent, it can be abuse. Abuse is trauma, and you know that trauma can affect you directly or indirectly.
You can just explain that.
Yeah. So indirectly, it's people like us, maybe a counselor or a psychologist. I get to sit down, listen to your trauma, listen to what you have went through.
Oh,
That's indirectly. But I'm not the one who had experienced those things. You are the one explaining everything to me. It's gonna affect me indirectly. That's why I always debrief, because it's a lot.
You can just explain what debriefing is.
It's a lot to
because,
do with.
it looks like it's an interesting.
No, to talk about it with my psychologist. Remember, I also do have a therapist, so I can just not necessarily talk about what that person had went through. We're not going to talk about my client or whatever.
Sure.
Debriefing means whatever that, how it's affecting me. So that will help me to actually calm down, because sometimes it can affect you. Or I'm a human being, right? I also have my traumas. So it can actually take me back to whatever that I have experienced. You understand? So debriefing, that's basically what it means.
Okay.
Yeah.
So in a situation where you are debriefing, right? Do you, as a psychologist, you guys are professionals, of course, right? Do you sometimes become so attached to someone's problem?
You don't have to, hey? You don't have to. You need to work. You don't have to be attached. Attached, okay, in a sense of what?
So let's say, for example, someone just comes and tells you that they're having a problem in their relationship, right?
Okay.
And you see how much the other spouse or partner is like toxic, right? And in your heart, you know that, okay, this person is like, this is a very bad thing for them. And you, when you're addressing the problem, you're like attached, because this is like someone that is your client, but you feel like as a human being, from human being to human being, you're like, okay, this is not good for your mental health, right? So do you psychologists get to a point where you're like attached in that way?
Do you know that situation? That's where you need to be brutally honest with your patients or your clients. There's something called co-joined. Co-joined is when you have counseling sessions with both your clients. So you're gonna have a session with maybe the wife, to put it, or the other person, the girlfriend.
Yeah.
And then you get to understand what the problem is, and then you're gonna have a conversation. Also, you have a conversation with the boyfriend or the husband, understand what the situation is. Then there's a co-joint. Now you come together. Isn't that you guys explain the situation separately? Now you come together. I need to hear both your stories in the same room now. That's where we will understand where the situation is. And if this one is wrong, I'm going to tell the person, that one, that no, you are wrong. This is how you should approach 1, 2, 3, 1, 2, 3. I'm not telling you on how to behave or how to treat your wife or how to treat your husband, but then I'm going to say it as it is based on what you guys are telling me. Something like that. Communication.
So like I was saying, that is there a point where as a psychologist you become attached to a case where you find like, okay, this is just too much for someone to experience?
Becoming attached is finding solutions for me. You don't have to become so attached that you focus on them a lot. If you feel like you're becoming so attached that you take their problems at home, best do a referral. Refer them to another psychologist.
Oh, I see. So is that the best way that you guys
for me? Yeah.
Or for you guys?
Yeah.
Yeah.
Yes.
Oh, interesting. Because
like you'd feel like, because when you're attached, some people actually bring the problems to the family or your family. You would call them at night, asking how they feel. It's okay to check up on them, but you don't have to like. It's like you're making them your friends. You don't get to do that. You have to act professionally.
So, well, how about those people who have been with their psychologists for years?
Yeah, they're not friends. I'm the psychologist, you are my patient. I'm going to help you. And also, it's not only about your relationship. Remember, some psychologists also help you about life coaching, your career-wise.
Yeah,
Exactly, how to cope with your daily life stresses or whatever. Yeah. So it comes to that as well. It's not only about the relationship. It's different aspects of life.
So that's what you do as well?
Yeah, I do that.
Oh, that's actually.
So you can see that it becomes a little bit difficult for one, right? So that's why you need your therapist as well. Yeah. I believe that psychologists or counselors or therapists also do need somebody to talk to because it's a lot to take in. Personally.
Talking about that, I think I asked you this question last time, and do psychologists get traumatized or
Yes,
depressed?
they do. Yes, they do. That's
Yeah.
why I said personally.
Yeah.
Hence, I explained to you about my trauma of being in an accident.
Sure.
So it brings us to your trauma, as I've explained, where it affects you indirectly, that I explained.
Yeah.
Now this is affecting me directly. Directly, I have experienced the trauma. I was there. I was involved in the accident. You see now, that has affected me directly. I dealt with it. Dealing with it, it's talking about it. It's acknowledging that actually this, it was not good. It was not good at all because I had, it was difficult for me to get into a car. Even if I'm not driving, even if you're driving, I would actually break with you. Exactly. So it was that bad. I have anxiety. I would have a fear every time when we have to embark on a journey. It was not difficult. And coming to Cape Town, I always tell my husband that, you know what, you can just drive. I'll go with the flight. I'm not doing that. The last time I did that, I bought Calmed's pills so that it can just calm me down.
Okay.
Yeah. So I never thought that in one day I would actually go to a garage and say, you know what, I'm going to buy myself, I'm going to bless myself with a car. It was never in my mind.
Yeah.
Until I dealt with it, then actually did it now. I think I'm fine.
No.
I'm becoming okay.
Yeah.
Yeah.
So it is. So I think you're still going to explain about trauma, right?
Okay.
Yeah. So you're saying that it affects you directly and indirectly.
Yeah.
And after trauma, I know we talked about PTSD. Is trauma
post-traumatic stress disorder.
Yes. Is trauma? There's like trauma, and under trauma is the PTSD, or there's other stuff.
Not under it. It's trauma, right? And there is PTSD. PTSD is post stress traumatic disorder, which means that I was involved in an accident.
Okay.
Being involved in an accident, maybe I get to witness an accident in front of me that brings flashbacks. So that's PTSD. Or I start developing sense of fear, anxiety, panic attacks and all that. That is PTSD. It's affecting me now. It's dealing with me, and it means that I have to take effective treatment. Effective treatment for me, it's seeing a therapist or to talk about it or do something about it, so that PTSD, it's affecting you.
Okay.
Yeah. So it's also sorry about that.
Yeah.
It also means that PTSD, it goes along with childhood trauma. Childhood trauma, be it maybe you grew up in a very poor background or in an abusive family, marriage, or rape. It can be anything. That's a childhood trauma. Do you know that childhood trauma is long-lasting? It can last you for a long term. It can affect you when you're an adult. It can affect you educationally. More especially people who are, it's a very sensitive one, this one, people who are raped at a very young age, most of them, they don't get to have proper relationships or marriage, and it's difficult for them to actually get those. And some of them, they do get raped when they grow up. Do you know that? I just don't know how they see that, but they do get raped when they grow up. So it's a very sensitive one. So that affects you. It's a long-term thing. So that is PTSD.
Okay. So there's no link between PTSD and trauma.
That's really the same thing, because it's trauma
itself.
It's traumatic. It's
itself,
traumatic events or traumatic situation that had happened to you.
Yeah.
So now you having flashbacks of what happened.
Oh,
do you understand?
see.
Maybe
Okay,
you were
okay.
once raped when you were a child, and then it gets to happen again when you grow up. Do you see that it's taking you back?
Oh, it's taking you back, so you get
You have
flashbacks.
exactly.
Oh, I see. So is that the explanation of trauma?
Yeah, basically. So that's why I say it doesn't have to be necessarily rape, doesn't have to be necessarily whatever that you feel like is traumatic to you and it gets to happen again, that's trauma for you. That's why I say people don't really understand it the way you would understand it. That's why I say over 70 people have had experienced that. I said about my experience with an accident. You can have a different trauma, maybe witnessing something. That's why I said it can affect you indirectly. Maybe witnessing my father beating my mother up, that's trauma for me.
Sure.
Yeah. So it's something like that.
So
have you ever experienced that though?
So
When you think about it?
In terms of childhood trauma.
Doesn't matter in
Trauma.
your life.
Yeah, I mean, that's why I was saying that the other time, like, it should be over 80% because at a point, everyone has experienced some form of trauma when they're growing up. And it's, I think there are people who deal with those things and people who don't, because I don't think I dealt with anything.
Okay.
It's just something which I guess I moved on, though it's in the back of my mind, but it's just something that happened.
Okay, don't you think whatever that had happened will affect you in future? Because maybe something similar will happen and then it will get you to think about whatever that had happened that you did not deal with. Don't you think it will happen? Don't you
No,
think
you
should
see,
deal with it?
that's the thing. The conversation has not happened in terms of how do you deal with that, if you get what I mean.
Okay, but then you have to identify the problem first for you to actually deal with that. So that's why sometimes I would always advise my clients to, if you are feeling some type of way today, why don't you write it down, the date and whatever, and if it happens again, the very same thing, write it again, like it's like traces,
Sure.
so that you can be able to identify what exactly it's making you feel that way.
Oh, so basically, it's like, is that the process of dealing with that trauma?
Yeah, it's a process of tracing what
So
exactly
maybe let's, for
it is.
example, let's
Yeah.
try to deal with a trauma, right? Let's say maybe when you were growing up, you experienced, let's say, in an abusive relationship, right?
All right.
And then you just saw someone, let's say, for example, let's say be your mother beating your father all the time.
I'm going to be mad because I know that I experienced that. I know how bad that thing is. I'm going to be
Sure.
very mad because I
Sure.
know I have experienced it. And if I did not talk about it, it's going to take me back. So that should be a reminder that, you know what, that's not right. Maybe it's high time I actually sit down and talk to someone about it. Also talk to your parents about it. Yeah.
So because I want us to give you a scenario, and
Okay.
maybe because the reason why I'm saying that is because like we were saying that each and everyone or most people have had some form of trauma, right?
Yeah.
And the way that I probably dealt with my trauma is just, okay, this has happened, and you moved on with your life, and probably, yes, it comes in your mind then
Years later.
yes, but it's not something that you kind of like dwell on it. You're like, okay, that happened, okay, yeah, that was
it, yeah.
you understand, and then you move on, right? So what would be the best possible way to say that, okay, this is an event that happened or episode that happened in my life, and this is how I want to deal with it, this is how I'm dealing with it, and this is where I'm no longer traumatized.
Yeah.
You understand what I mean? Because because the fact that you still remember it, that's why it's trauma, I guess.
Yeah. Remember when you're a child, for instance, sometimes you don't even know what's happening, right? And sometimes you just keep it to yourself. You feel like, maybe that's just how it is. Maybe that's how we live at home. You understand? But when you grow up, you start to understand that, no, but then this was not right. This actually affected me. And it can affect you in a sense of now you are experiencing the very same thing that was happening at home. It's happening to you. So that's when now you should take initiatives and learn more about how it affects you. Talk about it to someone. Don't talk about what is happening to you, only the root cause. everything that is happening around your mental health, your depression, whatever, your trauma more especially, has a root cause.
Because talking about that, right, it doesn't change the event.
No, it does not.
So how is it going to help if let's say we're talking about it actually triggers you?
Okay.
Right? So what would be the best option to deal with this trauma? Is it like you were saying, it's like you have to talk about it, like what causes the feelings, right? Is it something that you just like, they usually say, brush it under the carpet?
No,
right?
You don't brush it under the carpet.
So the reason why I'm asking that, right, is it's an episode that happened, which is traumatic, right?
Okay.
What's the best
solution
to view it? Is it something that this is what happened to me, and it is probably affects you in this way?
Okay.
Is it changing? Is solving it changing the ways that the negative ways that it affected you, or it's just talking about it?
It's helping you as well in your daily routine or your life, or because it can affect your relationship. I mentioned this before.
Sure.
Affecting your relationship, it can affect your relationship so bad. Communication sexually as well, which is not good at all. It can affect your how you communicate with your family as well. So talking about it, it's not only helping you only, it's also helping people around you understand what you had went through. So talking about it helps. So you go and seek help, acknowledge that you have experienced something, acknowledge that now it's also happening, and then find solutions. Don't dwell on the problems. Don't always say, I've experienced 1, 2, 3, 4, 1, 2, 3, if I'm going to behave this way. People should understand. Deal with it. Talk about it. Get help. There's social support. Talk to people. Have connection with people who actually understand what is it that you went through. We have different perspective of how we view things. But there are people who are trained for that. And they will help you.
So which means the best way to deal with trauma is not only talking about it, but also getting solutions of how it makes you feel and kind of like correcting that.
Yes, it's like that. It's like at school when we are writing, it can be an exam or class test. Don't we have corrections?
Yeah, we do.
It's something like that. Correct the mistakes before it gets deeper.
Oh, I see. Okay, so I think it's quite interesting how, because it's, though you can talk about it, it's like they usually say it's like a scar, it's like a tattoo.
It is. It is a scar. It doesn't mean that it's gonna go away.
It's not gonna go away, but you can just cruise through life. Though.
Thank you.
Though you know that this has happened.
Yes.
It's like someone who has killed someone, right? I don't know how that feels, or I've never experienced that.
Yeah.
Right? It's something which okay, I've taken a life, and though you went to correctional what?
Correctional service.
It's correctional services, right? Prison, right? Though you went to prison for that.
Or you ask for forgiveness. God forgives you. God forgives everyone. But it's still in you. Do you understand? But then the fact that you asked for forgiveness, you feel a little bit lighter. Now you know what impacts or what effects it does in your life. You're going to stop doing those things. You're going to change. You're going to direct your life in a positive way. You're going to try to live better.
Sure.
So, yeah, take it as that. You'll be at prison. When you are in prison, you'll be thinking about ways to live when you get out, maybe how to better yourself, maybe you can start off a business, you can go to school. It's actually school in prison, so it's something like that. It's bettering your life, redirecting your life.
Yeah, I think that was actually quite enlightening as well.
Yeah,
because like you were saying that there's like over 70% of people who have had like trauma, and that could be either in childhood or in adulthood, right?
Yeah.
So if we're moving on now to maybe another topic,
Like mental health.
mental health. So you can just jump into mental health. But with that said, because I think we talked about depression, we talked about trauma now. So now we're jumping into mental health.
You can do
right?
that. Mm-hmm.
So maybe you can just explain what is mental health.
What is mental health? All right. What I can say about mental health, right, is everybody, we all have mental health. Now, I'm going to explain why I say this. Mm-hmm. Like, it's a state of well-being. Mental health is a state of well-being. Okay. So with that being said, being mentally healthy means being resilient, having confidence, being able to cope with stress, feeling in control, feeling good about yourself, managing and expressing your emotions, building and maintaining like good relationships. That's basically it, right? That's being mentally healthy. Now, this is where the problems start. We all have those days where I feel like I'm stressed, I have anxiety, I'm afraid, I'm angry. We all have those days, right? That's normal. It's normal stress life. Sometimes you get stressed due to you need to meet deadlines at work. That's normal, right? Yeah, fine. So now, however, when these emotions become severe enough that it interferes the present ability to function daily, and it becomes a problem, and if it becomes very persistent, it leads to mental illness or mental health illness, to put it that way. Mental health illness, be it that depression that we talked about, okay, or there are a lot of mental health illnesses.
Maybe we can just explain them as well, so that we just.
I'm not gonna explain. There are a lot. I'm not gonna do that, but then I'm just gonna name them.
I think just name them. Just don't necessarily explain them, but just name them. Like
It's like your depression. We have explained trauma as well. There is schiz as well, schizophrenia. There is bipolar as well. Those are mental health illnesses. There are a lot of them. They are OCD, obsessive compulsive disorders. There's a lot of them. So yeah, those are mental health illnesses. So as I've explained, you can be mentally healthy. We are all mentally healthy, and we all have those days that we don't feel right. It becomes a problem where it interferes with a daily basis of how you function in your life, and it becomes a persistent thing. So now, if you don't act on it, or you don't do effective treatment, or you don't realize what it does in your life, right there, it becomes a problem, because mental health illnesses can become chronic. Do you know that?
Chronic in what sense?
Chronic, you can have a chronic disorder. Depression is chronic, right? It's a chronic illness. It's a chronic disorder, because a lot of people who have depression actually do take medication. You know that?
Yeah, I've heard of medication, and apparently it's not dimetropine or something like that. Is that the one?
No, it's a lot of them. There are antidepressants. There is, what's that? Is that PEX or what? Yeah, there's a lot of them. Mm-hmm. Yeah, there's a lot of them, and it's medication, it's psychotherapy as well.
So the best way to solve mental disorders or mental health illnesses is it's getting that either psychological therapy or be on medication.
Yeah. So, but as well, there's a lot of stigma around mental health. If you have realized, more especially the society does not believe in that. That's why these days we have mental health awareness, and I really commend or salute those people who actually took initiative to talk about mental health awareness, because they are educating us on how on what mental health is. So in that way, we get to understand what mental health is, and we can act towards whatever that is happening. So I would urge people to acknowledge, if you don't acknowledge that you actually have mental health problems, you're not going to heal. you're not gonna heal. You always feel like people don't love you or people act in a certain way around you. You always have those negative vibes around you. So just acknowledge that you have a problem. Deal with it. Let us help you. We're here. Why we here? I know that people are scared of, if I tell Valentia my things, she'll probably go gossip about me. I think we are all grown-ups right now. And if you don't want that, there are people who actually trained for that. So yeah.
So looking at how society is built now, right?
Yeah.
Would you say do you have any opinion on why is it that suicides are more prevalent on young children now than it was in our age or in the generation before?
I think times have changed, to put it. Things have changed, like as you have mentioned about social media. We do things in a different way. There is poverty now. There is lack of unemployment that leads to that as well. There is, a lot of crime. There is rape. There is a lot of things. So times have changed in terms of back then maybe I was able to get certain things easily. Right now I'm growing up. Things are not as easy as it may have been easy that time. I have to get a job. I have to look after myself. I don't get a job. Then poverty leads to what? Sometimes it leads to crime. Crime, sometimes you get caught and you get killed. What does it do to our family? Do you see the cycle?
So the reason why there is a high suicide rate now, would you say that it's social media, like you're saying?
No, it's not. I was just giving an example about social media because you have mentioned it, or how does it affect us mentally, or
Sure.
How does it have what is it? A role? Does it play a role in our life in terms of our trauma or whatever? So that's why I was saying that it's not necessarily because of that. People who have suicide, people who actually have thoughts of suicide, they do. Some people have depression. Some people, it's lack of unemployment, like we said, because they tend to think, why am I living? I don't get what I want. What's the point of living? So they listen to the voices that they're telling them that you're not good enough, good for nothing. So you might just end it, something like that. Yeah, not necessarily because it's social media. No, there's a lot of effect on that.
Yeah. Talking about that, I'm sure how long have you been a psychologist now?
How long have I been
A
a counselor right
yes.
now? It's been 2 years. Yeah.
2 years.
Yeah.
In your 2 years as a counselor, why is my question running away?
What year is this?
2022.
2022, right? Okay, yeah. Okay, fine.
I don't know why my question ran away. Shucks. I don't like when this.
Okay, let me help you with how can we help people with mental health. Maybe that can...
Yeah, maybe I'll just remember my question. Thank you.
maybe that... Yeah, actually. So how can we help them? You can actually include them, invite them to your small events, just listen to them when they talk, if they want to talk, if they need somebody to talk to, listen to them and reassure them that you are there for them, that you love them, check up on them. It doesn't have to be on a regular basis, but check up on them just to see how they are dealing with it and all that. That it makes them feel that, okay, Shepherd really cares about me. There's no need for me to do anything. Like, there's no need for me to kill myself or do whatever that will harm them. So checking up on them, encouraging them about life, about their goals, what they are about to achieve, and inviting them. And also, what can you do? Yeah, I think that's basically it. Or you just notice them and remind them of their small victories, whatever that they have achieved.
Okay, yeah.
It makes them feel so good that, I can actually do this. I have done this before. So
Sure.
what's stopping me now? So that it helps. It really helps a lot.
Okay.
Yeah.
I'll just digress a bit.
I think you forgot.
Yeah,
So that's where mental health awareness gets in, and self-care.
Sure.
Yeah.
Do you, as a psychologist, as a counselor, do you perhaps have a favorite, psychologist that you kind of look up to, or do you have one of your own, or one of the old ones that you know?
One of the old ones that I know. Not old ones, recent ones.
Yeah, sure.
There is one guy called Jason Rakubu. He is a psychologist. It's been, I don't know how long, but it's not so long, but he's a psychologist. He's a very good psychologist. He's actually the one who's helping me with a lot of things. He's actually the one who I do debrief with. So he's
beautiful.
quite a good guy. He became a very good friend of mine. Yeah, he strived me as a very good psychologist because he can actually break down your problem and you'd be so surprised. He will psychoanalyze you in a way that you wouldn't have imagined. So yeah, and I actually feel better after talking to him. He makes it even more better for me to talk to him about everything. That's just how good he is.
So which means you kind of
I look up to him.
Yes, you look up to him. But the question I want to ask is, when you're a psychologist, when you say you're a good psychologist or counselor,
can you say that? Okay.
No, that's what I want to find out, is when you are able to
solve cases
and you get someone who gets their life together after different episodes and stuff. So
yeah,
that's the bar that you use to.
When you are able to solve cases, maybe you can credit yourself. Yeah, actually you can credit yourself. Yeah. And
then how is that viewed? Do you have tabs on people that, okay, I've solved 1, 2, 3?
No, isn't it that you have you have,
in terms of recognition, how do they
you have your papers where you write everything. It's like the record of everything that you do and all that. So yeah, it's something like that. You don't have tabs where people give reviews. Remember, this thing is confidential.
It's confidential, yeah.
Mm-hmm.
But
reviews, you'll get it from people because they're telling you directly that, after our last session, I actually see things a different way. Something like that. Yeah. It's not going to be on social media or tabs or whatever. No. But you have to impress your clients or your patients. Yeah.
Funny enough, I do have a favorite psychologist.
Who's that?
I want to tell you a story.
Okay.
So I got interested in psychology a long time ago. I think probably 2 to 3 years back, right? And I just went deep into it, trying to find out how psychology and explaining where it started.
That thing will dribble you, bruh.
Right?
It's all about the human mind and behavior, how the mind works. So it can be very difficult. Remember, people are not the same. I'm trying to understand how Shepard thinks. I'm trying to understand how Valentia thinks. So people like both Sigmund Freud or something. They have put a lot of standards or ways of dealing with certain situations. Yeah, it's because they have been practicing a lot. They have been seeing patients and they have been diagnosing a lot of people. So now they actually, when you have a way of approaching a problem and you tend to realize that, okay, it's working fine, but you can approach it in a certain way. So you can just put it into practice. So it's like trying different medication to put it.
So which means they have seen so many clients that they can kind of put a conclusion that, okay, this is the reason why people act this way.
Exactly.
or this kind of trauma, the best way to deal with it is by introducing 1, 2, 3.
Yeah, exactly.
Oh,
So that's why there are, which is why we can have a lot of psychologists or counselors or whatever, but they don't get to approach problems or whatever situations the same.
The same way, yeah.
Yeah, they don't view it the same. They do it the best way they think it can help the client or the patient. So yeah, but following all the rules and regulations. So yeah.
Okay. And then with that said, oh yeah, I was still telling you the story about.
Yeah, you wanted to.
Yeah, so I went through going through people like Sigmund Freud. It seems like he was the one guy who was like, they call him the father of psychology.
Yeah, you mentioned that last
Yeah,
time.
this father of psychology.
Yeah.
And I had the privilege of not meeting, but of listening to, of bumping into a guy called Jordan Peterson.
Yeah, you mentioned that as well.
Yeah.
Yeah.
So he's like my favorite go-to guy because it seems like
It's knowledgeable.
Is not very knowledgeable, and it seems like even his methods in terms of getting people out of the
Methods. Thank you. Methods. You see, people have different methods.
Oh, okay, yeah. His methods of actually getting people out of either depression or a stagnant life, because sometimes you can feel like you're just not doing anything. The way that he explains the meaning of life
Yeah.
and purpose, doing your purpose, and getting into a end result of some sort.
Do you see now?
I actually love how he explains stuff because he's very much profound.
He's breaking it down.
Yeah, he actually breaks it down. Yeah,
He strikes me as a guy who you would actually want to sit down and talk to about whatever that you're experiencing in life by the way he explains things, because he's gonna break down whatever the problem that you have from the root cause, which is actually that something that should be done, because knowing the problem from the root cause, it will actually help you to understand why it got where it is now.
So, talking about root cause, right? I just want us to delve into the spiritual side of your work.
Spiritual, you say?
Yes.
Okay.
Because, like you said, emotions, feelings, you don't see them up until someone X them out. So it's like internal to external. The same way spirituality is
Okay.
invincible, but you see its effects physically.
Okay.
Can you marry your work with spirituality, or there's nothing like that? It's
You
just
can.
it's just chemicals.
No. You can actually, because I think I told you that there's one counselor whom we come from the same governance body who actually works with the Bible as a referral. So he actually, when she gives advices, it's a she, sorry, when she gives advices, she actually open her Bible and then look into the problem, and then it works a lot. Spiritual and psychology, can say God and psychology same
Goes
level.
hand in hand. So
Remember, you can't do anything without prayer. For me, you can. I don't think I would have dealt with my trauma, to put it, if it wasn't because of how I prayed. If it wasn't because of God, God helped me through it. God helped me conquer my fears. So God, therapy, talking about it, played a huge role in my healing process.
okay, so let's say, for example, these things like depression, right? And I remember the other time you said things like voices, right? If you were to put your hand on that, is the voices that are happening, is it things which you could say it's like a demonic event, or what's
I really-
actually happening.
I really
at
don't know
that
if it's a demonic or what. I
Yeah.
actually don't want to put it that way because I don't know if it's a demonic.
Yeah, that's why I was
thing.
a bit reluctant
know,
to say demonic, but
yeah.
like in terms of spirituality, how do you
Spirituality would actually say this is demons talking.
Sure.
We would actually, if you think about it, we would say that no man, that's a spiritual attack. Yeah, thank you, not demon. That's a spiritual attack.
Yeah.
Don't act on it, and they would actually do pray for you so that you don't act on whatever that you are going through. Voices in
Hurting
psychology,
yourself, cutting yourself,
yeah,
and all that.
voices in psychology, it's like you cannot do this. No, it's like you are frustrated. You are in a very dark place. You're not at peace. You're fighting with your brain. You're fighting with your mind. You're like, no man, I cannot do this. And other voice says, no, you can do this. Okay, let me put it this way.
Sure.
When you go into an interview, the job interview, you do practice, right? And you do pray, right? There are voices that, no man, I can do this. I know that I can do this. I was born for this. Something like that.
So with that, like when you as you're saying that there's voices that can be so negative and then being
Yeah.
put you in a very dark place.
Yeah.
Because that's what the effects, the end effects of depression would be suicide, right? That's the worst case scenario.
That's the worst case scenario because you're going to end your life.
So before that scenario of suicide, that means you are having a lot of dark
Yeah, you're in a very dark
imaginations,
place. Yeah.
dark voices.
Yeah.
That place where there is like those dark imaginations and all that. Would you say that it's also spiritual, like demonic activity?
That's why I'm really scared to actually label it as such. Hence, I said, in Christianity, or people who go to church would actually think, yeah, it's spiritual attacks, it's demonic and all that. But psychology, it's psychology. Those are voices. You're in a very dark place. You're being, yeah, that's just it. So I don't want to label it as it's demonic voices, or to put it that way. I don't want to label that way because, I actually don't know.
Okay. So which means that would you say that also psychology tries to move away from trying to spiritualize something, but give it a definite answer, like to run away, because like voices, because when you say you're listening to voices or you're hearing voices, that's an anomaly. It's not normal, right?
Yeah.
And you would from me from outside, I wouldn't be afraid to now introduce the spiritual, because why are the voices? Because when I think for myself. Why is my mind pushing me into thinking?
Remember, in psychology, it's a complex of series in your brains. It's like the chemical imbalances, whatever
Sure.
that you are experiencing at that point in time. Like I've mentioned, all the symptoms of whatever, or feelings of fear and whatever. Now
Yeah.
you are feeling like you're feeling feelings of hopelessness. It's like symptoms related to how you feel at that point in time. You feel sad. You feel like you cannot do anything. That's where thoughts come in. You are so demotivated. You feel like you have low self-esteem. Those are voices. Like you start having those voices. You start having thoughts of suicide. So it's something like that. So with spiritual, it's a different situation altogether, which I really don't understand how they view it in spiritual. Yeah, because I might step on toes. So yeah.
Yeah, sure. No, I understand. I really understand. So I think we have touched most of the stuff.
Yeah, we have touched most of the stuff. You can say something, but before we close up, I would really want to say something, but you can talk.
No, you can just say it. What you want to say?
Oh, I wanted to remember. I told you I have references.
Oh, yes. We can just talk about the references as well. Yeah.
Yes. So references. Guys, before that, just take care of yourselves. There's a self-care, knowing what makes you sad, acknowledging that you have a problem, knowing how your body reacts to certain situation, and knowing how you can help yourself. You can go far, far, far. And I would say, if you feel some type of way, if you feel like you need to talk, there is SADAG. It's for free. SADAG is a South African depression anxiety group. I can leave their numbers, which is 0800-567-567. There's also Tears Foundation. It's 010-590-5920. There is me as well. I am a registered counselor, so you can actually talk to me. Can call me on 072-4474-638. There is also a former Mrs. South Africa, Shudufatso.
Oh, yes.
She talks about mental health almost, it's like every Tuesday, if I'm not mistaken. She does lives on Instagram. She is an advocate of mental health. Please do listen to her as well. And there is one girl as well, my favorite. It's Mrs. P. Wuledi. She talks about mental health. She was talking about mental health and motherhood. And now she is diving into like mental health, everything. She's now on YouTube. You can get her stuff on Instagram as well. That's Mrs. P. Wuledi. So yeah, that's the people that I actually do listen to, and yeah.
Okay.
So yeah, and also schools as well. For those at schools, every school has got a psychologist or a counselor. There are clinics which is free for those people who don't have money, and those who have medical aids can go see their psychologist or therapist. And also there is EAP at work. If you're working, which is Employee Assistance Program, you can go talk to your HR. They will help you. Yeah.
Oh, that's beautiful. So for everyone who's listening to this and you feel like you have you're tired mentally. Yeah. So if before it gets out of hand, you can just contact the people that she talked about, SADC, Tears, and Voshidufazo and the other, and the various, and of course Valentia.
Yes.
And before you leave, I also want you to just give me the name of your YouTube channel.
The name of it's Valentia Mothakwa.
Valentia Mothakwa. So there you have it, guys. Yeah. Just follow her also on the YouTube. It's Valentia Mothakwa. You'll find some nice content there.
Yes,
and don't forget to press the subscribe button.
Yes, please.
And just comment there. Take a podcast.
Maybe if Shepard allows me to put this on my YouTube, I'll actually do that. You will listen to it there. So
awesome.
Yeah, all depends on him. So yeah, take charge of your life.
Yeah. There is the motto that you said last time when we were closing.
When I said that, I'll actually love it or urge people to talk about or tell their stories, because it might liberate someone out there. You know, when you talk about your story or what you had experienced, it can help someone out there to actually come out. So meaning that it can liberate someone out there.
Awesome. Thank you very much, V. It was an honor to have you here. And this is actually we did have our first catch up, but it's always nice to know that there's people around that you know. And keep on winning and raising that flag of mental illness awareness or mental health awareness. Yeah.
Thank you.
It's very much important to have this kind of conversation, because there has to be a right way of talking about it. It's a very early stage in our lives, though some people feel like we're being too sensitive about it. But it seems like it is affecting people, because people are killing themselves, which is not what we want.
Exactly.
Understand? So we appreciate that as the podcast.
Thank you so much, Sepet, and I really wish you all the best with your podcast. I love to see it grow. You're really doing a good thing. because social media is actually the relevant or right platform to talk about such or this kind of things. So thank you. Hope you grow.
Awesome.
I love to see this.
Awesome. Cheers, guys.
Thank you.